Comfrey, wound healing and inflammation control. Introduction. Comfrey is also referred to as Symphytum officinale, is a perennial herbaceous plant that has been utilized for a long time in traditional medicines to treat ailments. It's a native of Europe, as well as its roots and leaves are widely used in a variety of ways to heal wounds and decrease inflammation. Recently, there has been increasing interest in the healing benefits of comfrey. It is particularly effective for its capacity to aid in the healing of wounds and reduce inflammation. The purpose of this article is to examine the evidence-based science behind the efficacy of comfrey in the healing of wounds and control of inflammation. The active components of comfrey. Comfrey has a variety of active ingredients which contribute to its healing qualities. One of its main constituents is allantoin, which is a chemical that is known for its capacity to increase cell growth and aid in wound healing. Allantoin aids in increasing the speed of tissue healing and repair, which makes it a vital component in numerous topical products for healing wounds. In addition, comfrey is a rich source of the rosmarinic acid, an effective antioxidant which helps to reduce inflammation through reducing the creation of inflammation-related substances, including prostaglandins and cytokines. Rosmarinic acid is also known to have antibacterial qualities, which aid in the healing of wounds. Wound healing properties. Many studies have proven the healing capabilities of the comfrey plant. A study that was published within the Journal of Ethnopharmacology found that an ointment that contained the extract of comfrey significantly improved healing of wounds compared to non-comfrey ointment. Researchers found that comfrey could aid in healing through promoting the proliferation of cells and collagen production. A different study on animals found that comfrey extracts increased the tensile force of wounds, which indicates improved wound healing and the regeneration of tissues. The results suggest that comfrey could play an important role in treating various kinds of wounds like burns, cuts, and ulcers. Inflammation control. Alongside its healing properties for wounds, comfrey also has demonstrated positive results when it comes to reducing inflammation. Inflammation that is chronic can hinder the healing process of wounds and cause complications, like impaired regeneration of tissue and scar tissues. An article published within the Journal of Cellular and Molecular Medicine found that comfrey extracts inhibited production of pro-inflammatory compounds like tumor necrosis factor alpha, TNFA, as well as interleukin-1 beta, IL-1B. The results suggest that comfrey could be a good candidate to be an anti-inflammatory drug which is beneficial to ailments like arthritis or inflammation of the skin. Safety concerns. Although comfrey is known for its benefits for healing, it's important to be aware of the risks to safety that could arise from the use of it. Comfrey is a source of pyrrolizidine alkaloids, PAs, that are harmful compounds that could result in liver damage if consumed in large quantities or for a long time. In order to ensure the safety when using comfrey, it is advised to stay clear of consumption in the body and restrict its application to only topical uses. Comfrey that is of high quality and has been processed in order to eliminate or reduce the amount of PAs are recommended. Also, breastfeeding or pregnant women and those with liver diseases or impaired liver function must avoid consuming the comfrey. Conclusion. Comfrey is an important plant that has remarkable in terms of wound healing and control characteristics. The active ingredients like allantoin as well as the acid rosmarinic are responsible for its efficacy in encouraging healing of tissues and decreasing inflammation. But care must be taken when consuming comfrey and should only be taken externally and in controlled amounts in order to reduce the chance of damage to the liver that is caused by the consumption of it internally. More research is required to understand fully the mechanism of action as well as dosage guidelines for comfrey in order to make sure it is safe and effective application in wound healing and inflammation management.